Hi, my name is Dr. Andy Koehler, and I'm a pediatrician at Northwest Arkansas Pediatrics. I'm here today to talk to you about a number of issues that we'd like to address before returning to school this fall. The two issues I'm going to talk to you today about are vaccines and an asthma action plan. Here at Northwest Arkansas Pediatrics, we feel that vaccines are one of the most important things we do every day as pediatricians. Vaccines not only protect your child from these serious diseases, they also help protect the more vulnerable members of our community, whether that be an infant who's too young for vaccines, or a child with cancer who's on chemotherapy and thus can't provide a sufficient immune response for themselves. Having a community that has a high vaccination rate helps prevent these diseases from establishing themselves and helps protect all members of the community. The following vaccine-preventable diseases not long ago caused disability and death in thousands of American children. Many of these diseases you may be unfamiliar with now because the vaccines have been so successful in eliminating them from our community. All vaccines can cause some side effects, though in most cases these are minor, ranging from low-grade fever to pain at the injection site. The risk for a serious adverse event following a vaccine is very low, in many cases ranging from 1 in 100,000 to 1 in a million. Below is a list of the vaccines currently given in the United States, as well as a list of possible side effects that you will see with them. Remember, vaccines are continually monitored for safety, but like all medications, there is the potential for side effects. On the other hand, a decision not to immunize also carries significant risks, both to your child and to the community as a whole. One of the most common fears about vaccines is that they cause autism, but over the past decade this has also been an area that has been most closely studied, and after extensive research involving hundreds of thousands of patients, I feel comfortable today telling you that there is no link between this disease and vaccinations. Another common misconception is that vaccine-preventable illnesses have been essentially eliminated from the United States, and so there's no further need for vaccination. You only need to look to certain areas of the world where vaccine rates have fallen to know that this is not the case. In Great Britain and Japan, vaccine rates fell dramatically in the 80s and 90s. And shortly thereafter, their rates of vaccine-preventable disease, such as measles, whooping cough, and diphtheria, rose exponentially. There were numerous cases of these diseases and several hundred deaths associated with illnesses that are fully preventable in a vaccinated population. The last misconception that I'd like to address is that giving multiple vaccines increases a child's risk for serious events and is not healthy for the immune system, as it can overwhelm that immune system. This is just not true. The amount of actual antigen, which is the particle that causes the immune response, is dramatically lower in today's vaccines than even 10 or 20 years ago. Every day we are exposed to hundreds and thousands of antigens from things that we touch and things that we eat, far more than are ever given in any vaccine. Our body is specially designed to deal with all of these antigens, and it's how our immune system works. Vaccines do not overwhelm our immune system, they prepare it for future infection. Thank you for watching. Again, my name is Dr. Andy Koehler at Northwest Arkansas Pediatrics. If you need help, please feel free to give us a call. Our number is 479-442-7322, or you can visit us at the web at www.mana.md, and have a great summer. Thanks.